So, step one is now pass or fail. In this video today, I'm going to give my thoughts on that. What's up everyone, this is Dr. Webb here. Thank you guys for watching this video. Make sure you subscribe. New videos coming out every week. You don't want to miss them. So, some big news just came out from the USMLE. This is the governing system or the people that administer the testing for step one. For those who don't know what step one is, it's a 8-hour exam that you take after your second year of medical school. And before this, it was actually the most important test or most important part of your application, most important part of your medical career, because it determines, not always, there's some exceptions and some ways to get around various things, but it determines what specialty that you can enter. So the students who score higher on your step one, 240, 250, 260, 270, those are the students that go into the more competitive fields such as dermatology, neurosurgery, plastic surgery, orthopedics. Those are the students that get into these top specialties, and a lot of programs actually screen students and have minimum cutoff scores. The average for, let's say, orthopedics is around 240, 245. So if you only score a 220 or 215, then that places you at a really disadvantage from matching into orthopedics. Wow, this is pretty big news. The USMLE program will change score reporting for step one from a 3-digit numeric score to reporting only a pass-fail outcome. This can have a huge effect, not only for pre-med students, for medical students, but also downstream for a lot of specialties. Just because a lot of specialties, competitive ones, they use this as a screening score. So the question is, what will they use now? If they can't use step one, well, they're most likely going to use step two. The problem is that if you place a lot of emphasis on step two, the clinical skills portion of step two, so there's two parts: clinical knowledge, which is a written exam, 8 hours, and then the clinical skills, which you go into a location and you have a grade or tests based off of paid actors. So the question is, the clinical knowledge, is this test suffice to weed out certain applicants from certain specialties? I don't know. There's totally two different tests. So the step 2 CK is more of the clinical aspects, clinical vignettes. How do you work up this patient in the hospital? How do you treat this patient with a heart attack? It's contrasted to the step 1, which is more the basic science, pharmacology, physiology, embryology, all the crap that you really don't need to really know to be a doctor. I think to be a great doctor, the step 2 is a more, predictive test in terms of what you need to know to be a doctor. But some good things about this change is that I think one important test or one test does not determine whether one will be a good doctor or not. So a student who scores really low on the step 1 and may have had a bad test day, or something came up with his family or whatever, is not a good standardized test taker like myself, that doesn't mean that person's going to be a bad doctor or not a good doctor. And for someone to not be able to go into a certain specialty based off of the fact that they scored low on one particular test, I think that is not a good way to go about it. The second thing is that a lot of people, when they're studying for STEP, they tend to neglect a lot of things in terms of their health, in terms of friends, relationships, and they put everything on the back burner because they realize, or they've been told, that this test is a career-ending move if you don't score well on it. So a lot of people jeopardize a lot of things in terms of their health, family, friends, relationships, everything else to score well on this test. And with the burnout rate, with the suicide rate, with the anxiety, all of their types of psychological or psychiatric disorders in medicine, this may be a good move because it eliminates that stress. Like, hey, this is the most important test of my life. You know, if you're a doctor, if you want to be a spine surgeon, or if you want to be a dermatologist or plastic surgeon, that test will determine whether you will most likely become one of those physicians. So it eliminates that. So changing step 1 from a 3 numeric scoring system to a pass-fail may not be a bad idea. The problem is the programs, residency programs, are going to have to place emphasis on something else. And that may be step 2, which a lot of people use step 2 to take up for a low step 1. So if you score low on step 1, you may be able to take step 2 and try to increase your score to show the programs that, hey, I had a bad test day, or I worked really hard and I increased my score. So if your emphasis is placed on step 2, this means that you don't have a second chance. Or how do you recoup from a bad test day on step 2? There's no way to make up for it because step 3 is not until your intern year. So that is probably a downside. I think it will eliminate a lot of stress from a lot of people. You know, if you just have to pass, I probably wouldn't study for 18 hours a day. I would probably study for 12 or for 14. But still, you're going to make sure that you want to pass. But there's going to have to be emphasis on research, on letters of recommendation, on your AOA status, on your recommendation letter from the medical school. It's called your medical student performance evaluation. Lots of the emphasis is going to be placed on these other things. And if you don't have a strong, step 2 score, that may place you at a disadvantage. For international students who try to come to the US, this actually may hurt them because a lot of international students use this test to get into certain programs or to come to US programs. And let's say, or Caribbean or international student scores a 270, well, this will help them most likely get their foot into the door. If this is taken away and it's pass-fail, what else are you going to show the admissions committees that what else can you prove to them that they should pick you versus a U.S. candidate? So I think international students that are in foreign medical schools are going to have a harder time getting into U.S. residency programs unless the emphasis is placed on something else, like maybe step 2. Now you have to take step 2 at a reasonable time, make sure that you get your scores in before the application cycle. Me in orthopedics, I was instructed, and a lot of people in my class, my year, not to take step 2 if you did well on step 1. That way you don't have a bad test day and you don't go down on your score. So I actually didn't apply to orthopedics with a step 2 score, but a lot of programs now are most likely going to require that. So there's a lot of pros and cons to this. I can see the pros: alleviates and minimizes anxiety, the stress level, the fear that this is the most important test of your life or your career. It's a career-ending test, but it doesn't determine who's going to be a good doctor. These are objective tools that programs use to distinguish or differentiate one applicant from another. But there's been lots of good doctors out there that don't take standardized tests well, and there's lots of bad doctors out there that do really well on tests. So should the entire medical profession pathway go to pass-fail? That's a question, that needs to be answered. But lots of pros to this, lots of cons to this, and only time will tell. It doesn't look like it will take an effect until January 1st, 2022. So there's another, good 2 or so years before this actually takes place. For the medical students out there, study like you were getting a 3-digit score. You need to pass this test. It's important. Study for step 2 like it's a 3-digit score, which it is. You're going to have to do really well on step 2, your clinical knowledge. A lot of schools are going to a pass-fail system. A lot of schools are allowing students to complete their 3rd year of medical school before their step 1 or their step 2. I'm wondering if more schools will allow students to take their 3rd year of medical school, their rotations, and then take step 1 and step 2. That way you're more prepared for the most important test, or the more important test, step 2. Yeah, this is big news. Looking back over my years, I'm not sure if I would have wanted a pass-fail, because I worked really hard and I wanted to show people and I wanted to prove to myself that I can actually do well in medical school as well as on my boards and get into a competitive specialty. So if I didn't have that, I'm not sure what I would have done differently. But hey, 2022, step 1, pass-fail. What do you guys think? Put it in the comments below. Should step 1 be pass-fail, or should we have a numeric score that everyone's given to differentiate one student from another? I think schools should look holistically at students, look at the whole picture, their upbringings, what can they bring to the table, non-traditional students, their background, research, letters of recommendation, personal statement. A lot of these programs are going to have to look at everything to make a decision on which applicant to accept. This is Dr. Webb. Thank you for watching this video. Make sure you subscribe. New videos coming every week. We'll see you next time.